this sort of human cost, that things aren't right. Everything is too corporatized, and it's all about producing for some other for-profit entity, and it's not what we signed up for. And that's reflected in physician burnout statistics. And right now, I think it's 63% for emergency physicians, most recently, which raised after the pandemic. But I would contend that it's not the pandemic, it's not even people refusing vaccines or whatever that has done this, but rather the consolidation and opportunism by private equity and other non-physician large corporations that were looking to take advantage of the situation. So when you speak to all these physicians, we know there's a problem, but very few people are aware of the concept of the corporate practice of medicine and the doctrine and then the legal basis for it. So the intro that I had is a little bit outdated. I'm representing the organization Take Medicine Back, which is taking medicine back from corporate interests. The AMA is not here. The AHA is here. The AMA now maybe represents like 11% of practicing physicians, is estimated to be. We don't have that much of a voice, and to be honest, a lot of the organized medicine groups have been infiltrated by private or financial interests. So if we look back to the first Gilded Age, where antitrust really started getting its legs or became a thing, emerged. At the same time, physicians were recognizing that maybe being employees of the mining and railroad corporations was not such a good idea because they could commercialize the practice, they could influence the practice, and the concept of the corporate practice of medicine emerged. This was weakened over the past several decades along with antitrust law. And now I think we're starting to wake up physicians and say, hey, we thought about this before, maybe there was something to it. I'm an emergency physician, and I graduated from a residency program that was taken over by Team Health, and then the next year it was taken over by Blackstone. We saw a transition to all of our attendings being worried about this production thing, much less of a focus on our actual learning and education, and mostly they were worried about keeping their jobs and also decreased staffing, that kind of thing. That residency program, the physicians there just unionized and formed the first union against a private equity-backed contract management group or physician management company, depending how we use terminology there. I learned a lot more about the history of emergency medicine, which turns out there was a exploitative business model that was started in 70s, 80s. It wasn't initially owned by outside interests, but it was owned by some savvy emergency physicians. This was a contract management group model where you had a contract with multiple hospitals and then profited off the labor of your colleagues. But pretty quickly, those were sold to lay interests. There was the corporation out of Canada, Laidlaw, which eventually turned into Onyx, private equity, and then eventually MCare turned into Envision, which is now bankrupt, as you guys are probably pretty aware. That CEO just went to Humana, I believe, so we're kind of heading toward that vertical integration direction. So there was some support of private equity in emergency medicine because the sentiment was that we needed something big to fight the insurance companies that were really the evil ones. So we said, well, let's align ourselves with these private equity guys because they're great. And what we've really seen is, of course, that's a 3 to 7 year model, and they're selling to somebody else, which, if you could read tea leaves, was probably going to be the insurance companies. And so we look at this as when elephants fight, the grass suffers. The physicians, other healthcare workers, and the patients and the public basically are the grass, while these big behemoths of finance are doing battle. This is sort of the Amazon defense. We needed to, Amy Klobuchar, I believe, called it the Amazon defense. Well, we need to consolidate in order to fight the other big consolidated guys, and so consolidation begets more consolidation. So I'm going to make an appeal to the other panelists, the DOJ, the FTC, and to folks in this room to eliminate the word provider from your lexicon. We heard from the last panel where there was the AHA saying, they're the providers, and then we also had an attorney who represented providers against payers. I'm not sure which providers those are, but I imagine things like Team Health, Envision, which are owned by private equity firms that were suing United Health, which are now all becoming the same thing. But those are not physicians, and those aren't the healthcare workers at the bedside. Those are representing big private equity firms who are in violation of the corporate practice of medicine doctrine. And Maya Miller was on the last panel and did some excellent work with ProPublica, thank goodness for them. They have distinguished this, showing that private equity-backed groups were suing and garnishing the wages of poor patients during the surprise billing out-of-network disaster that was really driven by private equity firms. If anyone's aware with doctor-patient unity, doctor-patient unity was found to be a dark money group backed by Team Health and Envision primarily, which was Blackstone and KKR. And she also, in ProPublica, demonstrated that it wasn't physicians who were benefiting from these marked up bills, rather it was wealthy investors. What we really see is that physicians don't have transparency in what's billed and collected in our names. The American College of Emergency Physicians, when asked to support the idea that we have transparency, actually said in an analysis, maybe we shouldn't do that because it might leave physicians knowing, and then we'll be liable for the fraud that's being committed in our names. So that's kind of funny. So at this point, the AHA, so they represent providers, but they actually oppose the elimination of non-competes that the Federal Trade Commission has put forth, especially for physicians. And this is something that we believe drains communities of actual physician resources, because we can't go get a job at the next place over, and we don't have workplace protections so that when we actually advocate for patients, we can be fired on a whim, in particular when the hospitals, which is a large majority of them, contract with third parties like Team Health, Envision, any of these roll-ups, WCAS that's being sued by USAP, U.S. Anesthesia Partners, being sued by the FTC right now. So I think what's missing from the discussion much of the time is that while there's monopoly power that's built, there's also monopsony power over labor, and as 75% of physicians are employed, we are now labor, and they have more influence over us. And that also means they have more influence over the practice of medicine. So one more aspect of this is provider is conflating us with these big giant institutions. It's also conflating us with non-physician practitioners who we are increasingly being replaced with as another driver of profits. And an example that you might be familiar with is Cerebral. The Department of Justice is suing or investigating Cerebral, an online platform backed by VC, Silicon Valley kind of a startup that was providing like mental health care and like Adderall prescriptions, that kind of thing. If you look, they don't call their clinicians or physicians or even providers, they call them prescribers. CBS News did an investigation and found that of the 1,500 clinicians on a website, 5 of them were actually psychiatrists and 3/4 of them were nurse practitioners without even any mental health background. They found that there was 15-minute brief appointments, 5 prescriptions of psychiatric medications given to patients within this very brief workup, which is not sufficient even with an expert psychiatrist. One woman had her concerns blown off when she said she was having nightmares about suicide and hanging herself, and then she did attempt suicide and hung herself. So if that's sort of concerning to you, and we look at sort of pharma, PBMs, and insurance companies controlling this care, then I think the vertical integration that we're seeing that private equity has catalyzed is kind of a nightmare situation. You see CVS with Cigna, Aetna, or CVS Caremark, and then you have Minute Clinic, and now they just acquired One Medical. So now you have complete vertical integration and a push to remove physicians from the picture entirely and control the prescribing market. So now you have the PBMs, the insurance companies, the retail, all of it kind of rolled into one, and I'm sure you're going to hear plenty about United Health coming up next. Amazon as well, as sort of being the focus of the Federal Trade Commission's central thesis, really harkens back to the idea that the railroad and mining corporations of the past are coming back, and now they're employing physicians, right? They're going in non-physicians. They're going into that market with One Medical. So I think if we really look at this in a historical context, that should be extremely concerning to people.